If you or someone you love has been living with chronic pain, you know the effect it can have on a person's life. Fortunately, there is hope for relief. For many people, neurostimulation therapy has helped manage their chronic pain and enhanced their lives.
Before I had a neurostimulator, I was in pain all day long. I was using a lot of oral narcotics and patches and all kinds of things. That didn't actually help with the pain. It just helped me forget that I had the pain. I spent a lot of time on the couch and was quite depressed, actually. Are we decorating Matthew's room? My life has changed immensely since I got the neurostimulator. My husband and I have started a family. We have our 3 boys now.
Ooh, I love that.
That looks great. I'm able to play with them and be the mom that I've always wanted to be, and my husband and I are active and enjoying life.
That's so nice of you, Dawson.
Neurostimulation therapy is a treatment proven safe and effective for the management of chronic pain. A neurostimulator is a device similar to a pacemaker, surgically implanted under the skin, typically in your abdomen or upper buttocks. The neurostimulator delivers mild electrical impulses to an area near your spine. The electrical impulses travel from the device to your spine over thin, insulated medical wires called leads. Neurostimulation, in a way, outsmarts your pain. The signals from the neurostimulator reach your brain before the pain signal can arrive, so you feel a tingling sensation rather than the pain. Many people experience improvements in their pain symptoms and quality of life after receiving Medtronic neurostimulation therapy.
Our desire is to really help you control your pain better. And one of the things that I tell individuals that are contemplating this is that it's one of the few surgical operations that you actually get the trial before you commit to the permanent implantation. Unlike other surgeries where you have to guess what your final outcome is going to be, the trial stage really lets you see whether this treatment's for you. You get to see if it helps you improve your pain control. We may not be able to completely eliminate your pain, but we want to significantly reduce it. Also, the other benefits of a spinal cord stimulator system is that we can improve your pain control, and thus, by improving your pain control, our desire is to help improve your function. The other thing is that it's a reversible and non-destructive treatment. So unlike a second or third back surgery where you're going to have a major operation, this we are able to control your pain, but without destroying a lot of tissues in the process. Another benefit from a spinal cord stimulation system is that our desire is that we may be able to help you lower your pain medications. You may still need to take some pain medications, but hopefully you can take lower doses and find those lower doses to be more effective. And by lowering your doses, hopefully you'll have lower levels of side effects from some of those oral medications.
My home life is so much better. I can go out fishing with my son again. I can go sit in a boat. Don't have to worry about the waves or the rocking or anything that gave me that constant pain before. I can move around again like I used to many years ago.
Hey Dan, how you doing?
When I'm working, I got work to do, I'm out there, I'm moving. And I've told people, I think I've got a hop, skip, and a jump in my walk now. It's wonderful.
So when you sit down with your physician and you're making a decision whether you should consider a spinal cord stimulation trial and possibly an implant, it's important for you to understand the risks. Some of the risks are similar to a trial. We worry about bleeding, infection, nerve damage. We worry about the possibility of a spinal headache. Once the device has been implanted, we have also other concerns. One of the concerns is that we want to do everything to limit your risk of infection, because if this system was to become infected, it has to be removed. Some of the other risks associated with a spinal cord stimulator implant are that we worry about the lead moving. If it moves, there's a possibility that we may not be able to cover the area that was really bothering you. Now, the first thing we'll do is we'll try to reprogram the system to see if we can cover that area again. If we can't, there's the possibility that we may have to go in back surgically and revise the system and put the lead back in the appropriate position.
Neurostimulation provides advantages over other therapies used to treat chronic pain. One important advantage is that you can try it first during a screening test.
One of the really favorable things with the spinal cord stimulator trial is that you get to test out the system and see if it helps you. And the reason we do this is just like with every other surgical operation, is some people don't respond as well as we have predicted. But the nice thing with the trial is you get to determine that before you progress forward to a permanent implant. Some of the other nice things about a spinal cord stimulator trial is that it's a reversible and non-destructive treatment option. So you get to actually try this, and then it can be removed at the end of the trial. And so if it does not help you, you have not lost anything.
Unlike oral medications that circulate throughout your entire body, neurostimulation targets the precise area where you are feeling pain.
A good candidate for neurostimulation therapy is a patient who has primarily nerve-related pain. In addition, those patients usually have had the opportunity to have treatments that are simpler, less involved, and they've progressed up the cascade of treatments, if you will. So they've had simple pain medicines, they've had exercise and physical therapy and rehabilitation, and they might have had some injections.
Initially, I injured myself playing football. I had 4 back surgeries previous, and it got to the point where it was pretty much live with what the pain is, and there's nothing more that we can do.
Well, the goal of neurostimulation therapy is to improve, quite simply, the patient's quality of life and pain relief. The specific improvements that we see in our patients, and certainly that we want to achieve, are improvements in the side effects and the complications of chronic illness. So we want to see patients sleeping better. We want to see them using fewer medications. We'd like to see them having a better exercise tolerance and ability to walk or perform the activities of daily living that are realistic goals for them.
Now that I have the neurostimulator, my life has definitely changed for the better. I can actually walk again, and I can actually I couldn't do that for about 2 years, so now I can walk again, I can stand up straight again, I can actually function and be a part of society again, as far as I'm concerned. That's what I wanted to be, is get back to being as normal as possible.
To prepare for the possibility of receiving neurostimulation, you will have a screening test to see if neurostimulation can help manage your pain.
So if you decide to progress forward with a spinal cord stimulator trial and possibly implant, one of the things that we will ask you to do is go for a psychological evaluation. Now, this has nothing to do with the way we're thinking about you. It's just that many insurance companies require it, and I also think it's very helpful because it helps us determine if there's a psychological condition that at this point may require additional treatment before we consider progressing forward with the trial. And the reason we do this is we really want to make sure that you can have the best results from this treatment.
During the screening test, you can assess how well the neurostimulator relieves your pain during different activities. Similar to how the fully implanted system works, the external device that is worn around your waist delivers mild electrical impulses to an area near your spine. The impulses travel from the device to your spine through thin insulated medical wires called leads. A screening cable connects the leads to the external neurostimulator, and a MyStim programmer is provided to allow you to adjust stimulation levels so you may obtain the best possible pain relief. Your screening test will likely take place on an outpatient basis in the doctor's office, day surgery center, or hospital, and you may be able to go home on the same day as the procedure.
The nice thing about the trial is you have it usually for 3 to 5 days, and it allows you to work with the system. Also, you get to see if it helps improve your function by controlling your pain better. Many individuals, when you talk to them about a spinal cord stimulator trial and you're thinking that this therapy is appropriate for them at this time, they're concerned about what's going to happen the day of the trial. And so I think it's important that you really sit down with your physician or your healthcare provider and get a good explanation of what's going to happen.
For an overview of general steps your doctor will take during the test screening procedure, please review the procedure section of the printed materials included in this DVD packet. When you are home, you should engage in your normal activities, as this will help you and your doctor evaluate how well the stimulation addresses your pain. During the screening test, your doctor may restrict certain activities, such as taking a shower or bath or submerging your body in water, limiting physical activity levels to low or moderate levels, lifting not more than 5 pounds, bending, stretching, climbing, or extended reaching, climbing too many stairs, or sitting for too long at one time, sexual activity, operating power equipment or heavy machinery, or having your back manipulated by a chiropractor or a healthcare provider.
So typically a trial lasts 3 to 5 days. And you'll come to the office and we will give you an opportunity at that time to also work again with programming or to ask any other questions that you might have. Once we've given you enough time to work with the device, at the end of that appointment, we will remove the leads and we will clean off the area and place Band-Aids. This is done right in the office. We will then at that point discuss with you what you thought about the spinal cord stimulation trial, going over some of those expectations that we had discussed before. We at that point will discuss with you the possibility of progressing forward to implanting the system. We don't do it that day, and you don't have to make a decision that day. If you need more time to think about it, that's also appropriate.
When considering neurostimulation therapy, it is normal to have concerns. Please review the Can You Address My Concerns section of the printed materials in this DVD packet for answers to commonly asked questions. Medtronic has transformed the lives of hundreds of thousands of people with chronic pain using neurostimulation therapy. You should feel confident about receiving a Medtronic neurostimulation system for many reasons, including Medtronic is a worldwide leader in medical technology and the largest medical device company in the world. Neurostimulation therapy was developed by Medtronic, and Medtronic neurostimulators are FDA approved for MRI head scans. The Medtronic Ambassador Program puts people like you, those who are considering the therapy, in touch with a volunteer who is living with the therapy and is interested in sharing their experience with you. To talk with an ambassador, call 1-888-430-PAIN or visit www.painambassadors.com. Now that you know more about neurostimulation, consider having a screening test to see if the therapy will help relieve the pain you've been enduring. At Medtronic, our goal is to help you rejoin your life.
My view of the future now is brighter, definitely, no question about that. I still have physical limitations, but there are many things that I can do. I want to do what I can do. I feel good. I want to be active. There's things that I'm doing in my community that it's wonderful. It's changed my life.
I've got my husband back. We can go do things that we want to do. We can travel. He couldn't walk any distance. Now he's able to do that again. We'll be able to play with our granddaughter, and future grandbabies. And that's just, it's a rosy picture.
The preceding stories are the experiences of people who have received relief from their chronic pain. Not everyone responds to neurostimulation therapy in the same way, and your experience may vary. Talk to your doctor to determine if neurostimulation is an option for you. As the worldwide leader in medical technology, we've been working with doctors and patients around the world to develop pain therapies longer than any other medical company. We would like the opportunity to help improve your life.